You are listening to Champions of Care, brought to you by Oakwood Healthcare on News Talk 760 WJR. Oakwood, we specialize in you. Once again, here's your host, Lloyd Jackson.
According to the New York Times, it's estimated that about 92 people out of 1,000 have an MRI each year in the U.S., and 278 people out of 1,000 have a CT scan. There is another alternative to diagnose this source of joint pain. It's musculoskeletal ultrasound, a diagnostic test option now available at Oakwood. In the studio with me today is Dr. Stephen Solomon, an Oakwood-affiliated radiologist who sees patients in 2 locations in Dearborn and throughout the Oakwood system. Also here, Dr. Richard Needleman, an Oakwood-affiliated orthopedic surgeon with the Wayne State University Physicians Group with offices in Dearborn as well. Gentlemen, thank you so much for coming in and spending some time with me on the Champions of Care.
Thank you.
Dr. Solomon, I want to start with you. Can you kind of introduce yourself to our listeners, your educational background and how long you've been with Oakwood?
Sure. I'm a musculoskeletal radiologist affiliated with the Oakwood healthcare system. I grew up here locally in Metro Detroit. From there, I went on to complete my undergraduate studies at Colorado State University. I majored in biological sciences with a minor in anatomy. After that, I went to medical school at Michigan State University College of Osteopathic Medicine. After med school, I did my residency training in radiology at the Oakwood system, and following that, completed my fellowship at down the street from here, musculoskeletal imaging, including musculoskeletal ultrasound at Henry Ford Hospital. I've now been with the Oakwood system for about 2 years.
What made you want to be a radiologist?
Well, I've always been fascinated by anatomy in general, especially orthopedic anatomy, interested in sports imaging, sports medicine, and sports injuries, especially joint pathology in general. I did consider a career in orthopedic surgery, but I was more interested in the imaging aspect and the smaller procedures related to that, so I chose to become musculoskeletal radiologist.
Dr. Needleman, I'm going to ask you the same question. Kind of introduce yourself to the listeners out there. Where did you go to school? How long have you been with Oakwood?
Lloyd, I've been in practice since 1984, and prior to that I went to medical school in the University of Vermont, followed by my residency training at George Washington University in our nation's capital. Mm-hmm. After practice for 3 years as a general orthopedist, I saw the light and saw that most orthopedists were going to subspecialize, so I went back into school in Milwaukee, Wisconsin, and so for the last 20-plus years I've restricted my practice to problems of the foot and ankle.
So how do you work with a radiologist like Dr. Solomon?
Dr. Solomon represents cutting-edge technology, whereupon many of my patients would have pain in their feet, and they could have a CAT scan, they could have an MRI. Those patients who we would send for an MRI, many of them were claustrophobic. They'd be cooped up in a really narrow MRI. Insurance companies were quite concerned about the cost of these ancillary studies, which were in the 4 figures. This newfangled technology, I think, was brought to the States from Europe, and it seems to be sweeping the country and becoming very popular in this country, called musculoskeletal ultrasound, where for someone like myself, I love it because it helps to identify a problem, particularly of the soft tissues of ligaments and tendons. Mm-hmm. It can identify whether someone has a cancerous malignant tumor or something benign, such as a cyst, and it can be very helpful, similar to how an ultrasound can be used in obstetrics for needle localization. So the precise location of the needle can be placed, numbing medicine can be added, and if we can eliminate pain with a simple test, then I know that's exactly the site of the problem.
It's a win-win right there. Dr. Solomon, when might someone need to have an imaging exam?
Well, there's many different reasons for having an imaging exam. Most important is to determine whether something is surgical or medical. But in general, many different symptoms that different patients have lead us to needing imaging studies. Mm-hmm. It also helps in the emergency room determining the acuity of someone's injury.
Let's talk about, if we can, the more traditional imaging services and how each of these work. Let's start off first with the CT scan. And what does CT stand for?
Well, CT scan, also known as CAT scan, stands for computed tomographic scan, or computed tomography scan. It's basically using X-ray with multiple detectors, an array of multiple detectors, and gives us an imaging, a cross-sectional image, 2-dimensional, 3-dimensional image.
Now, MRI, what does that stand for?
Magnetic resonance imaging.
And how does that work?
That also gives us cross-sectional images, but uses magnetic fields and radio waves and the image is more based on tissue characteristics rather than X-ray. And that doesn't have any sort of radiation. That's the benefit of that.
Now, fluoroscopy, what's that?
Fluoroscopy uses the typical X-ray that we're all familiar with, like a chest X-ray, for example. Using that term fluoroscopy typically means that we're getting real-time imaging, like you'd see with an upper GI examination or maybe with needle localization.
Now, are there some concerns, Dr. Solomon, using these types of imaging services for some patients?
Well, definitely. With CT scan and fluoroscopy, especially in this day and age, there's always the concern for excessive radiation exposure. So we want to use these procedures appropriately. MRI, fortunately, does not use radiation, but isn't appropriate for everyone. As Dr. Needleman said, there's patients that are claustrophobic. Other issues include most pacemakers, certain metallic implants, but also some of those things can be overcome with some of our newer MR units, such as our open scanner that we have at Oakwood Annapolis, and also our wide bore MR unit we have at Oakwood Hospital. But definitely ultrasound has a great use in this patient population.
Now let's talk about the musculoskeletal ultrasound. How does that work, and what is that?
Well, just like regular ultrasound, it uses sound waves to create a two-dimensional image. MSK ultrasound, or musculoskeletal ultrasound, specifically is used for orthopedic type injuries, things of the joints, injuries of the joints, ligaments, tendons and muscles, things like rotator cuff tears, joint effusions. Not only that, it's also used for therapeutic purposes. We can use it for joint injections, aspirations, or even muscle or mass biopsies. It's especially beneficial for those who are unable to obtain MRs due to insurance issues or other contraindications like we discussed.
Now, is it different than the ultrasound people may be familiar with for pregnancy or other routine checks?
Essentially, it's the same type of technology that we use for that type of imaging. But in MSK ultrasound, we're typically acquiring images during dynamic movements in an attempt to reproduce patients' symptoms and view pathology real time.
Speaking with Dr. Stephen Solomon, an Oakwood-affiliated radiologist who sees patients in 2 locations in Dearborn and throughout the Oakwood system. Also here with me this morning is Dr. Richard Needleman, an Oakwood-affiliated orthopedic surgeon with the Wayne State University Physicians Group with offices in Dearborn as well. Dr. Needleman, what are the benefits of musculoskeletal ultrasound from your perspective as an orthopedic surgeon?
This cutting-edge technology is quite beneficial because it helps me determine in a much more precise fashion where and why my patients hurt. That literally the tendons can be seen to be moving as if it was a movie, and frequently it could be seen that there might be tendinitis around the tendon or within the tendon or even tendon tears. And if there's a question of whether this is what's causing the pain or not, Dr. Solomon can essentially stick a needle with the guide of an ultrasound and put a little numbing medicine right nearby and see if the pain is eliminated or not.
What are some of the more common reasons someone might need to have this type of exam?
Well, there's 28 different bones in the foot, and many of them are quite close together. And on top of these bones are layers of tendons that glide near the bones. So sometimes it's difficult to determine where exactly the pain is coming from. So the needle can be placed on one location, maybe in one of the joints, such as the ankle joint, or maybe a joint just underneath the ankle joint called the subtalar joint, or it could be placed within tendons that cross either of these joints, and we can determine, is the pain coming from the ankle, the subtalar joint, or the tendons on the inside or the outside of the ankle.
So how do you decide, Dr. Needleman, what type of scan a patient might need for diagnosing a certain issue?
Well, that's a good question, because I'm asked this quite frequently, whether it be from patients or insurance companies who are trying to keep down the price of medical care. One advantage of musculoskeletal ultrasound is cost, because it's much cheaper than MRI, so this might be a go-to test. The other advantage of this study is that it's quick. You don't have to sit in an MRI for 45 minutes. You can get your diagnosis very, very fast. These machines are portable. Interestingly enough, they are going to be brought to the Olympics. They have been brought in outer space, and they are in the emergency room. So
wow.
I can foresee a use well into the future, maybe the near future, of on the field at a high school event in addition to a college event, too.
So could a patient come in and say, listen, doctor, I like to have the musculoskeletal ultrasound instead of the MRI, or is that something that the physician needs to determine?
You know, my patients challenge me on a daily basis And I am very open to patients coming up to me and saying, is this a situation that we should get a musculoskeletal ultrasound? And, the patients are right quite a bit of the time, and I think they should go ahead and ask for it. And we'll talk about whether it might be the proper thing to do. The one point I need to make is that with CAT scan, it is an X-ray study, and one of the strengths of the CAT scan is the ability to identify solid bone, which an ultrasound can identify this, but it can't get inside the bone like an X-ray can. So an ultrasound is not going to be a good test for arthritis. It's not going to be a good test looking for loose bones floating around a joint. But we can use it, and it should be suggested.
Dr. Solomon, what else would you like the listeners to know of the champions of care about musculoskeletal ultrasound?
Well, one benefit is it allows us to have a real-time interaction with the patient. Unlike other imaging modalities where the patient is alone with the scanner, this allows us real-time assessment where they can tell us, when I do this movement is when I have the pain, and we can actually see it real-time. Also, in terms of procedures, unlike, as Dr. Needleman is mentioning, fluoroscopy, where needles